Morning, everybody. Thanks very much for showing up. I'm always intrigued when it comes to breathing and the word breath work because I think it conjures different ideas and different interpretations. One person might feel that breathing is all about breathing in 4, 7, 8, or breathing in for 5 seconds and out for 5 seconds. Another person feels that breathing is all about hyperventilation. Another person might feel breathing is hyperventilation and long breath holds. Another person feels that their breathing is all about the diaphragm. So what is breathing? Breathing is something, of course, that we are doing every minute, every hour, every day. And it's reported that 75% of people with anxiety and panic disorder have dysfunctional breathing patterns. That is their breathing on a continuous basis. And if you have to bear in mind that when you have a major challenge or trauma or stress in your life, your breathing will change. It goes hand in hand. Whenever we are stressed, our breathing changes. But what happens if we are chronically stressed? Then we develop dysfunctional and poor breathing patterns. And that poor breathing pattern will continuously feed into the stress response. Because there's a lot of communication going from the body to the brain. And not only is there communication from the body to the brain, but also the brain is literally spying on our breathing. So back in 2017, Stanford Medical School, they identified a structure in the brain in the pre-Bötzinger complex. And they said there's a group of neurons there that are spying on your breathing. And if you breathe fast, if you breathe irregular, if you are stopping breathing and sighing, if you're upper chest breathing, your brain is interpreting that your body is under threat. And that will cause arousal in the brain. Of course, the brain is all about survival. If your brain interprets that the body is under threat, you've got launched into a fight or flight response. It's not going to be a time for creativity. It's not going to be a time for rational thinking. It's not going to be a time for decision making. It's going to be a time for survival. And many people are stuck in that mode all the time. So if breathing and the mind are so intricately linked, why don't we look at breathing? Why isn't breathing a major part of what you do? And I'm not talking about 4, 7, 8. And I'll tell you why. 4, 7, 8 involves breathing in for 4 seconds, holding for 7 seconds, and breathing out for 8 seconds. So 4 and 7 is 11, and 8 is 19. So that's reducing the respiratory rate down to 3 breaths per minute. But many of your clients are breathing 15, 16, 17, 18, 19, 20 plus breaths per minute. And if they are already feeling uncomfortable with their breathing, their drive to breathe is strong. They're feeling that they're not getting enough air. They will tell you, I just can't take a deep breath. I feel suffocated. So they're already feeling this way. And then if you were to say to this person, now what I would like you to do is really slow down your breathing, which on the face of it makes sense. But in practical terms, it doesn't. And the reason being is because when you go from a respiratory rate of 20 breaths per minute down to 3 breaths per minute or 4 breaths per minute, it's going to generate a lot of discomfort. These people can have a very strong reaction to air hunger. They don't call it air hunger, they call it suffocation. So there's more going on with breathing, especially with the populations that you work with. I was working with asthma from 2002, sleep disorder breathing, easy, up until about 2010, only asthma and sleep disorder breathing. With the economic crash, I started putting it out there for anxiety and panic disorder. I made mistake after mistake after mistake. I put more people into panic attacks than I ever thought that I would happen. And this was after working with this for 8 years. I thought I knew it, but I was dealing with a different individual because the person who was prone to anxiety and prone to panic attacks, they don't often have a good relationship with their breathing because their breathing is the problem at the face of it whenever they have a panic attack. And they can develop a condition. So you can imagine your client having a panic attack. With that, especially if they have a respiratory subtype. So there are different individuals. There's different groups even within panic disorder. There's some groups that are fine with breathing, but then there's some groups that when they have a panic attack, it really affects the respiratory system. They will describe the symptoms to you. I feel I'm choking. I feel my chest is so tight. I feel I can't get enough air. I feel suffocated. And when your client says to you those symptoms, you know that breathing is at the heart of that. You will never address that using cognitive training. Cognitive training is targeting the brain. You will only address that by targeting the respiratory physiology which is contributing to that in the first place. You can say to the person, well, have you ever died because of suffocation? Has it done you any harm? And of course, it may allay their fears, but it doesn't address the actual suffocation that they are experiencing on a day-to-day basis. And not only that, so when a person is conditioned and they have those symptoms during a panic attack, and then they're going about their normal everyday life, and they're walking down the street, and they feel a little bit of air hunger, they interpret that as a panic attack coming on. They have a catastrophic misinterpretation of the feeling of suffocation, which in turn is going to generate anxiety, which in turn will cause them to breathe harder and faster, which in turn is blowing off too much carbon dioxide. Because when you breathe too hard and too fast, you get rid of too much of the gas carbon dioxide. And carbon dioxide isn't just this waste gas. It's never about breathe in oxygen and get rid of this poisonous CO2. That's not correct. We only breathe out 15% of the carbon dioxide we produce. We have this gas that's produced inside the human body. And it is true that we breathe out excess CO2, but the key word there is excess. We hold on to 85% of it. Why do we hold on to 85% of CO2? Because it's a vasodilator. It improves your blood circulation. If you breathe too much air, does it mean that you have more or less oxygen going to the brain? Does it mean that you have more or less blood flow going to the brain? Does it mean that you are calmer? If you go into a yoga studio and the yoga instructor cues you to take full deep breaths, and even if you're just breathing 4 breaths per minute, you have to consider how much air are you breathing with each breath. You can slow down the respiratory rate, but it doesn't mean that you're going to reduce minute volume. Because as you slow down the respiratory rate, the volume of air that you breathe with each breath increases. And the question to ask is, how much does this volume of air increase by? Because that person can end up over-breathing. So slow breathing does not work. And it does not work because it's not taking into consideration the tidal volume. We have to think about minute ventilation. At 10 o'clock, as Kiki says, you have a brunch. You will have a plate of food. You're going to use a utensil, a fork. So with that, your fork, we'll say that is your tidal volume. You could have a small fork or you could have a big fork. And the number of forkfuls that you draw that food into your mouth, that's your respiratory rate. So the number of forkfuls multiplied by the size of the fork will determine the volume of food that's on the plate. Does that make sense? Now, if you're a dietitian, what are you going to focus on? Are you going to ask how many forkfuls of food did you have today? Or what size fork did you use today? Or how much food did you eat today? That's what a dietitian understands. And every time that you have your meal, you're not considering how many forkfuls, you're not considering the size of the fork, you're considering what's the volume of food that I'm eating, if I keep it in simple terms and don't go into calories and things like that. But with breathing, where is all the attention? The attention is on the number of forkfuls that you have. How many breaths per minute do you have? Is it over 15 breaths? Fast breathing indicates a stress response. Are you breathing shallow in the upper chest? Are you sighing? Are you holding your breath? What about minute volume? Because it's the respiratory rate multiplied by tidal volume that determines minute volume. You can either decrease blood flow to the brain by 10 to 20% by changing breathing patterns, or you can increase blood flow to the brain by between 5 and 10%. I was lucky enough to come across breathing back in the late 1990s. I left school initially at 14 years of age. And the only reason I'm talking about this story is because a lot of your clients are going to be in the same boat. I was in school, I was looking at what the teacher was saying, but I wasn't paying attention to what the teacher was saying because my attention was stuck in my head. Or if I was reading a book, my eyes were looking at the page, but my attention was not on the content. My attention wasn't on the text. And I would get to the bottom of the page and I would have remembered nothing, and I'd have to start over again. So out of a sense of frustration, I said, school is absolutely not for me, and it wasn't that I wasn't driven. I can absolutely assure you, I was driven, and I wanted to succeed, but I felt that the school system was not doing it for me. So I left school because I wanted to go into retail and I wanted to own my own supermarket. So that was my ambition back then at 14 years of age. I ended up going back to school 1 year later, and I studied hard, I studied very hard. I got into university, studied all the way through university, and got my degree. Got into the corporate world. Didn't like it one bit. Couldn't cope with the stress levels. I was a chronic mouth breather, nasal obstruction, faster breather, upper chest breather, and poor sleep with undiagnosed sleep apnea. Now, you think that when some child or teenager or young adult goes through the education system, they need to have the capacity to hold attention. They need to have the capacity to concentrate. They need to have the energy levels to be able to hold attention on that, to learn the curriculum. But what about the children who are mouth breathers? 30 to 60% of children are mouth breathing. Now, I know mouth breathing isn't the easiest thing to diagnose, but in the literature you will see that the incidence of mouth breathing in children ranges from 30 to 60%. Mouth isn't for breathing. So even just coming from the very basics, our mouth is not for breathing. There is nothing inside your mouth that serves any purpose for the breath. What is in your mouth? Your teeth, your tongue, your hard palate, your soft palate, your gums, your saliva, the back of the throat. Do any of those things do anything for your breathing? What does your teeth do? What does your tongue do? What does the palate do? What do your gums do? What does saliva do? Nothing for breathing. It's for eating, it's for drinking, it's for speaking. So if there's nothing inside your mouth for breathing, why are we persistently breathing through an open mouth? And why are so many children and adults, and especially kids with neurodivergence, look at those children coming into you. Look at the children coming in with ADD and ADHD and autism. Are they breathing through their nose or breathing through their mouths? Are they leaving your practice? They're coming in with their mouths open and they're leaving with their mouths open. I know it is so simple, and this isn't a lecture to you, but I came across a newspaper article after 23 years of mouth breathing, going to doctors, being in hospital with asthma, and having respiratory consultants look at my breathing, and never once was I told, Patrick, breathe through your nose. I read a newspaper article, I did a nose and blocking exercise, which I will show you. I switched to nasal breathing, and I will say it changed my life. It didn't change my life, it saved my life. And the only reason that I'll say that is because I was a young kid and a teenager stuck in my head all the time, constantly ruminating. I didn't have anxiety. I didn't have any diagnosed condition. Maybe I might have had ADD, but it wasn't diagnosed. But I was able to get out of my head. My thought activity has reduced by about 30%. And it's not because I'm directing my attention anywhere. My brain has changed in 25 years. I spent 25 years stuck in my head and 25 years having some degree of control and freedom, not spending so much time stuck in my head, not spending so much time in rumination, and having a capacity to be able to make better decisions, not being hijacked and bombarded by negative and repetitive thinking, the broken record that's going on with all of your clients. And what did I do? I only changed my breathing. And the thing about this, it's so simple that it has been overlooked. But don't dismiss it on its simplicity, because the tools then that I learned back then, even if I was to never teach one person, it literally has done so much for me. So, why is there a difference between mouth and nose breathing? I would like you to look down at your chest. So look down at your chest and take your breath through your mouth. Take another breath through your mouth. Take another breath through your mouth. How does your brain interpret that? Where are you breathing into? You're breathing into the upper chest. But are you breathing fast or slow? You're going to be breathing fast. So mouth breathing is fast and upper chest breathing straight off. Your brain is interpreting that the body is under threat. Mouth breathers are going to be in an increased sympathetic response. Now, how about taking 5 of those deep breaths? Take a deep breath in through your mouth and a deep breath out. And a big sigh. Sigh breath in, sigh breath out, sigh breath in, sigh breath out, sigh breath in, sigh breath out. What's happening there? What's happening in your blood circulation? If you were to continue that for 30 seconds, what would happen? You can lower carbon dioxide in the lungs by almost half. And every 1 millimeter drop of CO2 reduces blood flow to the brain by 2%. You literally have a tool in your hands to increase blood flow to the brain. The brain is an organ that consumes 20% of oxygen, 15 to 25% of cardiac output. It's only 2% of our body weight. So for an organ, it consumes 10 times more oxygen in comparison to any organ for its weight. But we can influence that. But it's not by breathing more air. It's by breathing less. And this brings me back to the breathing exercise of slowing down the breath. Or you're going into your yoga studio and the yoga instructor is cueing you to breathe and you're hearing people breathing in the class. If you can hear people breathing in that class, run out of that class. Because that yoga instructor, while focusing solely on the respiratory rate, is not paying attention to tidal volume, is not paying attention to minute volume, is not paying attention to carbon dioxide, is not paying attention to blood flow, is not paying attention to oxygen delivery, is not paying attention to excitability of the brain, is not paying attention to the default mode network, is not paying attention to the nervous system. That yoga instructor is teaching breathing but doesn't have any background understanding of physiology. And the only reason, and this isn't a criticism, this is just the realization of it. You can go in on YouTube, look at how breathing is normally thought. Does it involve taking full deep breaths? Full deep breaths only came into being in about 1880. The origins of yoga, going back 2,000 or 5,000 years ago, was about conservation of the breath. It was about breathing light. It was about breathing less air. Yogi masters could hold their breath for 180 seconds. If you can hold your breath for 180 seconds, you have tremendous control over your breathing. You've got a reduced chemosensitivity to carbon dioxide. You have a reduced psychological perception of the feeling of air hunger. But that only happens by training your breathing. And how do you train your breathing to achieve that? It's not by breathing more air. It's by breathing less air. So, when you breathe through your mouth, if you look at the research that's come out with the default mode network, and just for those of you who mightn't be familiar with it, it was identified with individuals doing fMRI that when they were having task-oriented focus, that different parts of the brain lit up. But then when those individuals went into daydreaming mode, the parts of the brain that lit up during task-oriented focus kind of switched off, and other parts of the brain lit up. And it was quite consistent. So researchers then called this is the default mode network. So it's never that the brain is doing nothing. The brain is always doing something, and even the energy use, whether you're focused on something or not, the energy use is only about 5%. But if you breathe through your mouth, does it influence the activity of the default mode network? Does it influence the connectivity of the default mode network, bearing in mind that the default mode network is when rumination is taking place? And if you've increased activity of these different regions of the brain, you are going to be overthinking. You're going to be stuck in your head. And with that, of course, when we're stuck in our head and overthinking, a lot of the thoughts that are coming into the mind, they aren't necessarily helpful. But the researchers found that when you are breathing through an open mouth, it lights up parts of the brain associated with speech. And speech and thinking go together. So there is different activity in the default mode network, whether you breathe through your mouth or whether you breathe through your nose. The other benefit of breathing in and out through your nose is especially in terms of slowing down the speed of the exhalation. So again, what I would like you to do is to take a breath through your mouth and a breath out through your mouth. And I would like you to identify the speed of your breathing at that point. So when you breathe out through your mouth, is your breathing fast or slow? Typically, it's going to be fast. And the reason being is because your nose is a smaller entry and exit for air to come in and out of the body. Your nose imposes a resistance to your breathing that's 2 to 3 times that of the mouth. Now, if you're breathing out fast, is that inducing relaxation or is that inducing stress? It's a stressor. So now you have your mouth-breathing child. They have different regions of the brain lighting up, increasing rumination. They are breathing in a way that's activating the upper chest, which is a stressor. They are breathing out fast, which is a stressor. But these kids with their mouth open are going to have reduced sleep quality, not just for children. 50% of you in this room wake up with a dry mouth every morning. And I will tell you this, you are not waking up feeling refreshed. So I'm going to come back to my story. I read the newspaper article. I did the nose unblocking exercise to decongest your nose. If any of your clients have a stuffy nose, they don't just have a stuffy nose. They are likely to have poor sleep. They're also likely to have reduced cognitive function. You can check that in the literature. So people with a stuffy nose have 2 to 3 times more likely to have sleep disorder breathing, whether it's snoring, upper airway resistance syndrome, obstructive sleep apnea. And then I started practicing breathing less air. And I always had cold hands and feet, always, throughout my life. And I sat there and I can remember softening and slowing down the speed of my breathing. And I can remember the temperature of my hands increasing. And I continued with that. And that night I closed my mouth. And the first morning I woke up, but I don't really remember waking up with much of a difference. But I kept on breathing through my nose the second day, all day long. Not just a breathing practice that you do sitting on the mat. It's your breathing every minute, every hour, every day. I closed my mouth again that night, and I woke up, and it was the best night's sleep that I could ever remember. If you have poor sleep, you're not going to be waking up refreshed. And if you're not waking up refreshed, you're more likely to be ruminating. You're more likely to be stuck in your head. You're not able to function in the demands of daily life. And that can drive up anxiety. We can never dissociate breathing from the mind, and we can never dissociate breathing from sleep, and we can never dissociate sleep from the mind. If your breathing is off, it is having some influence on your state of mind. If your state of mind is off, and if you're overthinking, that in turn is going to change your breathing patterns, because the mind doesn't necessarily, or the body doesn't differentiate between a real event and an imagined event. So there's a bi-directional relationship going there. So your breathing affects your state of mind, and then if you have a lot of rumination in your mind, it's difficult to fall asleep. You have insomnia. You might be waking up. You might have difficulty falling asleep initially, but also you might wake up at 3 o'clock in the morning, which will affect much more women than men. And women, when it comes to sleep, are the forgotten gender. And there wouldn't be enough time to talk about it. But there's huge implications there, and women also are more likely to ruminate than men. But if your sleep is off, that affects your state of mind. So you see, when your mind is ruminating, you can't sleep so readily. But when you don't get adequate sleep, you're waking up feeling unrefreshed, and you're more likely to be anxious. And look at the association between ADD and ADHD and poor sleep. So there's a three-way connection going together. So whenever we want to help to reduce the thought activity going on in the mind, we have to think of the brain, we have to think of the nervous system, and we have to think of the sleep. But these are the tools that are freely accessible to you and to your clients for the rest of their life. But the thing about anxiety and panic disorder, that sometimes people don't have a good relationship with their breathing, and that's kind of understanding. And you might ask the person, pay attention to your breath, and they feel, I'm getting stressed. Because they can have a catastrophic misinterpretation of any symptoms that they're feeling. Because remember that 75% of them are reported to have dysfunctional breathing. Now, I don't like the word dysfunctional breathing, but that's the word that's being used. But an easy way to understand dysfunctional breathing is, how do you breathe when you get into a stressful situation? Does your breathing get faster or slower? Faster. Do you breathe higher or do you breathe lower when you get into a stressful situation? You breathe higher. When you get stressed, do you have regular breathing, or do you sigh more, or do you stop breathing? We sigh more, we stop breathing. We often breathe through an open mouth. And also when we get stressed, we breathe harder. So the breathing pattern of how we breathe when we are in a challenging situation is the exact same traits of how we breathe with dysfunctional breathing. But they are subtle. They're not so obvious. But you will see them if you look for them. Look down at your breathing. How fast are you breathing? You don't have to count it. Get a sense of your breath. How hard are you breathing? When you take that breath of air into your lungs, how much air is coming into your body? What's the speed of your exhalation relative to your inhalation? If we're telling the brain that we are safe every minute, every hour, every day, the exhalation is what stimulates the vagus nerve, but only when we breathe out slow. During inspiration, the vagus nerve steps back. During expiration, the vagus nerve is activated. And when you have that really slow and relaxed exhalation, you are stimulating the vagus nerve, which secretes a neurotransmitter called acetylcholine, which causes the heart rate to slow down, and the brain interprets that the body is safe. And even if you're just sitting there now, and you take a soft breath in through your nose, and you have a slow, relaxed, and gentle breath out, you are telling the brain that your body is safe. You don't have to do 4-7-8. And the only reason being is because there, when you do that, you are tailoring breathing relative to how you were breathing at that time. Everybody has a different breathing pattern. Everybody. And this was only identified about 2 months ago. And they compared breathing to a fingerprint. They looked at about 100 individuals. They looked at their breathing patterns, and then they asked the question, could we recognize each individual based on their breathing pattern? And they had a high likelihood of being able to recognize that individual. So we are all unique with our breathing because of our life experiences, our genetics, our makeup. And that's something to take into consideration when you do breathing exercise. If our breathing is all different, how can you give a breathing exercise that's put out there for everybody? We need to gently tailor the exercises to that person. So I'm going to kind of go a little bit backwards. I talked about people with a poor relationship with their breathing. So if they come into me and they have a poor relationship with their breathing, I still want to be able to activate the relaxation response, but I want to activate it in a way that they don't have to pay attention to their breath. So I'm going to start off with a very simple, gentle breath hold exercise. Because remember we said that relaxation was in the speed of the exhalation. But if you have an individual who is uncomfortable having a slow, gentle exhalation, what you could simply do is just ask them to take a soft breath in through the nose and a soft breath out through the nose and hold their breath for about 3 to 5 seconds, because that in turn is extending the speed of the exhalation without them having to pay attention to their breathing. And when you hold that breath after an exhalation, you're extending the exhalation. You're telling the brain that you're safe. And as you hold the breath a little, carbon dioxide increases a little in your lungs. And that in turn is going to increase in the blood. And it's known since 1930 that blood pH is very important in terms of brain cell excitability. And the primary regulator of blood pH is carbon dioxide. It's not the food that we eat. If we breathe too much air, we blow off too much carbon dioxide. And it's very easy to get rid of carbon dioxide from the lungs. And if you lower CO2 in the lungs, you're going to lower CO2 in the blood, leaving the lungs, because it just goes without question because of diffusion. If you lower CO2 in the lungs and blood, you increase blood pH. And that in turn increases brain cell excitability. The brain, by regulating breathing, controls its own excitability. There's a very famous paper that was written back in 1988 by Somnian and Balestrino. It was also referenced by Andrew Huberman more recently, about 6 months ago. So carbon dioxide is a gas that we produce internally. All we have to do is breathe a little bit less air to hold on to it. Does that make sense? And if we have a habit of breathing a little bit less air, practice throughout the day, we have to reduce our chemical drive to breathe. We have to reduce the chemosensitivity to carbon dioxide. We also help to install or to change the behavior of breathing, because of course carbon dioxide, even though it's the primary driver to breathe, it's not the only driver to breathe. So let's start with this simple exercise, short breath holds. If you are prone to panic disorder, what I would say is we'll start you off with about 3 seconds. So remember I said that when I was teaching breathing exercise and I started working solely with people with anxiety and panic disorder, I started generating panic and fear and anxiety, and that is genuine. And it took me a while just to kind of figure out, because I couldn't figure it out. I had literally worked with 600 clients a year from 2002 up until 2010. So I wasn't new to it. That's about 4,000 clients. And yet, when I have the group of people with anxiety and panic disorder, I start making mistakes. Why? Because I went in too hard. I didn't take into consideration their relationship with their breathing, their interpretation of the symptoms that they experience because of the conditioning of their anxiety. And it's not just anxiety and panic disorder, OCD, agoraphobia, depression, mental health. Look at breathing across all mental health issues. The brain and the breath is interlinked. So let's give it a go. So whenever you're ready, take a normal breath in through your nose. And we shouldn't really hear your breathing. So just a normal breath in through your nose and a normal breath out through your nose. And hold your nose and hold for a count of 1, 2, 3. Let go, but breathe in through your nose. And now to breathe normally for about 10, 15 seconds. So if we can make our clients feel safe, and if we can give them very gentle introduction to breathing, and they start to make and to feel a difference of it, and I will genuinely say it can make a huge difference, because we are targeting the symptoms associated with respiration that's involved when they are having their symptoms. And again, take a normal breath in through your nose and out through your nose, and hold your breath and hold for 1, 2, 3. But then let go, but breathe in through your nose. And even during the breath hold, nitric oxide will accumulate just a little in your nose. So when you hold your breath, this gas accumulates in the nasal cavity And then you let go, you carry nitric oxide from your nose into your lungs. Nitric oxide redistributes the blood throughout the lungs. Nitric oxide is antiviral, it's antibacterial. It helps open up the airways. And it's known since 1988 that the partial pressure of oxygen in the blood increases by nearly 10% when you continuously nasal breathe. It's never just about the air that comes into the body. We have to think about the air that reaches the small air sacs in the lungs. We have to think about oxygen transfer from the lungs into the blood. We have to think about oxygen delivery from the blood to the tissues and organs, including the brain. We can influence every step of that journey. Don't just pay attention to stage 1. Think about stage 4. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and hold your breath for this time for 1, 2, 3, 4. Let go, but breathe in through your nose, and then just breathe normally. Now, if you feel air hunger just doing that, that is telling you something. That's not driven by CO2, by the way, because carbon dioxide wouldn't accumulate so quickly. There's a fear response kicking in there that the amygdala is hijacking just a little bit. If you feel air hunger so easy early on, does that make sense? So it can be a little test for yourself. And if you do, it's important to help to desensitize your reaction to air hunger. And how do you do that? You do it by doing it very, very gentle. Very gentle. But also you do it by improving your functional everyday breathing pattern so that you're not on the brink of symptoms all the time. People who have dysfunctional breathing or poor breathing patterns, they feel air hunger, very, very common. They will tell you, I feel I can't take a deep breath. I feel I can't take enough air into my body. I feel I'm not getting enough air. And they are terrified of those symptoms. That's a problem, not just with their breathing then. That's a problem in their normal, everyday breathing. You look at their breathing when they come into you. How do they breathe? They are on the brink of symptoms. And all it takes is a little bit of a stressor just to push them over the edge. And of course, their interpretation of the symptoms associated with that, which drives their breathing, which in turn is causing them to hyperventilate, reducing blood flow to the brain, reducing oxygen delivery to the brain, increasing brain cell excitability, and it feeds on in itself. It's a vicious cycle. It's not just a challenging situation that changes our breathing pattern, but it's our breathing pattern which is going to dictate and influence how we interpret that challenging situation. Let's go again with 5 seconds. So whenever you're ready, take a normal breath in through your nose and out through your nose, and hold your nose and hold your breath for 5, 4, 3, 2, 1. Let go, but breathe in through your nose. We shouldn't really hear your breathing. Just breathe normally for about 10 to 15 seconds. Some of you are starting to bring up a little bit of mucus. Have you noticed that? And the reason being is, remember we talked about nitric oxide. And we also talked about carbon dioxide, and both are bronchodilators. And that's very important, because if you can help open up the airways, breathing just becomes a little bit easier. Because if the airways are narrowing, it's not a nice feeling. If the airways are narrowing, we feel we're not getting enough air. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose. I think you took a breath in and held. 5, 4, 3, 2, 1. Let go, breathe in through your nose, and breathe normally for about 10 to 15 seconds. So you're just breathing normally for 10 to 15 seconds. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose, and breathe normally for 10 to 15 seconds. If your head is racing, do this. If your head feels really heavy, do this, but start off with yourselves first. Mindfulness is not going to work for the very person who needs it most. How could it be? How can you be practicing mind aware when your mind is all over the place? And the issue there is that the person who might be trying to practice mindfulness will find it so frustrating and so challenging that they will just give it up. And again, take a normal breath in through your nose and out through the nose, and pinch your nose and hold your nose, and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose and breathe normally for about 10 to 15 seconds. There's a paper by Tolan in 2014. And he looked at individuals with anxiety and different mental health conditions. And he looked at their end-tidal CO2. So what's the partial pressure of carbon dioxide in their lungs, which gives you a good reflection of the CO2 in the blood. And the paper was, do people with low CO2 with anxiety, are they more likely to drop out of therapy? And the conclusion was that they were. How much more? Twice as likely. And the reason being is because cognitive behavioral therapy in this instance was looking at the cognition, but it wasn't addressing the underlying respiratory physiology, and those individuals with low CO2 were having dysfunctional breathing patterns. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and hold for 5, 4, 3, 2, 1. Let go, but breathe in through your nose. There's another paper by Davies, and he looked at 61 individuals with OCD and generalized anxiety and panic disorder. And he looked at the individuals with low end-tidal CO2, and then he looked at their quality of life. He had them do cognitive behavioral therapy and acceptance therapy. And these individuals with low end-tidal CO2 had reduced quality of life. So even though they were looking at cognitive training, the individuals with low end-tidal CO2 didn't fare as well as the individuals with normal CO2. And again, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and hold for 5, 4, 3, 2, 1, let go. I'm going to extend it a little bit. Now, I'm going to have to say to you is, be very careful yourselves if you do have a background of anxiety or panic disorder. If you feel that the air hunger can be a little bit terrifying, because we have to bear in mind that air hunger is a primal fear. Now, at the same time, air hunger is only telling you that there's an increase of CO2 in the lungs and blood, okay? And of course, the air hunger is going to be influenced by your brain's interpretation of the fact that you've stopped breathing. So go gently if you feel that you have quite a strong reaction to air hunger or suffocation. But I want to show you how to decongest your nose. Don't do this, please, if you're pregnant. Yeah? Congratulations if you are, but please don't do any of the more exercises. If you have cardiovascular issues, you have to go easy. And of course, with panic disorder and anxiety, go easy as well, yeah? Take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose, and now gently nod your head up and down, holding your breath. And nod your head up and down for about 5 to 10 head nods. So 5 to 10 head nods, holding your breath, and then let go, but breathe in through your nose. Your clients with a stuffy nose don't just have a stuffy nose, they are likely to be sleepy. Your clients with a stuffy nose don't just have a stuffy nose, they're likely to breathe through an open mouth. And if they breathe through an open mouth, they're likely to have increased sympathetic drive, increased rumination, and poor sleep. There's very few studies investigating mouth breathing in the adult population. It's only about 2 studies. 2 studies. That's all I can find. But a lot of it has been on children. Can we go with that nose and blocking exercise again? So whenever you're ready, take a normal breath in through your nose and out through your nose, and hold your nose. And this time, just gently nod your head up and down, 10 times holding your breath. 10 times holding your breath. And relax into it. If you can give a tailored dose of air hunger, you help to desensitize your body's reaction to it. Try and breathe through the nose. And at the end of it, let go, but breathe in and out through your nose. And I think it's very important for people to understand that air hunger, that's not a deprivation of oxygen. Oxygen does not drive your breathing. Every breath that you take is primarily driven by carbon dioxide. But the question to ask is, how sensitive are you to the gas carbon dioxide? And people who have experienced trauma or high stress or genetic predisposition to panic disorder, anxiety, or mental health issues, they can have a strong sensitivity to carbon dioxide. And when you have a strong sensitivity to carbon dioxide, the drive to breathe is strong. You will be breathing faster. You will be breathing harder. You will feel that you're not getting enough air. And if you feel that you're not getting enough air, where are you going to breathe into? Generally the mouth, because you will do whatever you can do to bypass or to alleviate that sensation of air hunger. But where else do you breathe to when you feel you're not getting enough air? In the upper chest. So if your goal is to bring people with good recruitment of the diaphragm, because you know your diaphragm is stimulating the vagus nerve, you have to alleviate and eliminate the thing that's causing the person to be upper chest breathing in the first place. You can't just focus on the diaphragm. When we think about breathing, it's multidimensional, yeah? Can we go again with the nose and blocking exercise? Now also check in what's happening in your brain when you do this exercise, because this is like a little shot of CO2 to the brain. So it can have a calming effect, even though it's increasing CO2 and it generates air hunger. And there's a little bit of a conflict because, of course, air hunger is a psychological stressor, but CO2 is a physiological relaxation. Take a normal breath in through your nose and out through your nose, and hold your nose and gently nod your head up and down and hold your breath for about 10 head nods, but please listen to your body, don't listen to me. Your body will tell you more. And you're just gently nodding your head, and it's so safe to do because when you were children, you used to swim, and maybe you still swim, and maybe you have children and they throw something into the bottom of the pool and then they go after it and they swim down to the bottom. They are holding their breath. And doctors years ago used to prescribe swimming or used to encourage their children coming in with asthma to swim. Why? Swimming involves breathing less air. When you're swimming, your body is on the water's pressing against the body, you're breathing against resistance. When you're swimming, your face is in the water. Yes, you take a mouth breath, but you don't take that many mouth breaths in comparison to other physical exercise. If you breathe less air, you're holding on to the CO2 to more normal levels. And carbon dioxide does help to open up the airways. And of course, it's not just the airways. Take a normal breath in through your nose and out through your nose and pinch your nose and hold your nose. If you're comfortable, try it for 15 head nods. But again, listen to your body and just gently do it. And surrender to the feeling of air hunger, bearing in mind that this is a primal fear, and this is the most primal fear of the human body. Can you surrender to the feeling of air hunger? Can you train your brain not to react so strongly to that feeling, but you have to do it gentle? And if you have asthma, practice that exercise. If you have if your nose is stuffy, practice that exercise. Now, you can also practice it if you're constipated. And the only reason that I put that one in is because, of course, when you're breathing hard and fast, things constrict. When we're stressed, we breathe hard and fast. Things constrict. When we are relaxed, when we practice slowing down our breathing and softening the breath and breathing in and out through the nose and doing physical exercise with our mouth closed, we help to improve our breathing patterns and things open up. And we help to dampen the stress response and increase relaxation. Let's do a little bit about breathing less air. Breathing less air often is counterintuitive. But instead of just going straight into air hunger, I'm just going to go into soft breathing. So last night I was asked by the ladies at the front, what would I do if I'm getting up on stage to help regulate the nervous system? And there's been times that I was going to do a talk, especially large groups of people, and my heart rate was just pumping out of my chest. And I remember going into one talk, and my heart rate was pumping away. And somebody says to me, "Patrick, take a deep breath." And I says, "No, I'm not taking any deep breaths." And I just stood there, and all I did was bring my attention inwards. And I softened the speed of the inhalation, and I just gently slowed down the speed of the exhalation. And I did it for only about 20-30 seconds. But I brought down the speed of my heart rate. And I put my critical mind aside. And I dispersed my attention throughout the body. And I walked out on stage, and there were cameras. It was a big event. And I spoke with every cell of my body. Without slides. Getting into a flow state. Getting into a state of mind where you're totally immersed in what you're doing, that there's no differentiation between the person and the task at hand. And that's something that you can replicate, but you can only do that if you have control over your physiology, because anxiety is the sabotage of flow. And if you have an individual and their objective is to improve their mental performance, and maybe your objective is to improve your mental performance, we can develop our capacity to hold our attention. But you have to think about the brain. You have to think about blood flow to the brain. You have to think about oxygen delivery to the brain. You have to think about blood pH. You have to think about the default mode network. You have to think about the nervous system and sleep. And I know that sounds a lot, but it's only a few simple breathing exercises. And that's the thing about breathing. So we're going to start off with a very gentle exercise, the exercise that I did to help bring down my heart rate. And I will also say this, the fact that I knew that I had an exercise there gave me comfort. And it alleviates the stress of getting up on stage. And especially without slides, because you're a little bit naked up here without slides. There's no safety net. So you really need to have trust in your own physiology. And when you practice this in small situations yourself, start off small. Little things that might kind of bring a little bit of angst throughout the day. And you're feeling a small bit of angst. And just bring your attention inwards. And take a soft breath in through your nose. And just a slow, gentle breath out. And I would just like you to practice this as you're doing it here. You don't have to time your breathing. Because what I would like to do is, I would like you to soften your breath relative to how you breathe. And I can't give you a time because everybody is going to be breathing a little bit differently. And if you can tailor it according to how you're breathing at that time, you'll have a much better effect. So you're taking a soft breath in through your nose. And then on the breath out, just bring a feeling of relaxation to the body and to allow the air to leave the body effortlessly. And the ratio of the breath out to the breath in, the breath out should be about 1.5 to 2 times the length of the breath in. So you're taking a soft breath in through your nose, and a relaxed and a slow and a gentle breath out. You will never see this on Instagram because there's nothing to see. And the beauty about this is that there is nothing to see, that you can use this in any situation, and you have some degree of influence over the nervous system. And even what I would like you to do is just locate your pulse rate just at the carotid artery, the angle of your jaw there, or you could locate it on your wrist. And get a sense of how fast your heart rate is. And as you get a sense of how fast your heart rate is, bring your attention onto your breathing. And the question to ask is, are you able to gently slow down the speed of your heart rate? How would you do that? And it's not going to be on the inspiration, but it's more going to be on the expiration. As you take that soft breath in through the nose, and you just have a gentle and slow and relaxed and gentle breath out, are you able to slow down the speed of the heart rate so the time difference beat to beat increases? And as you breathe in, you may notice that your heart rate is just a little bit faster. And as you breathe out, you may notice that the time difference beat to beat is just a little bit longer. And yes, you do have control over the cardiovascular system. And if you can control the speed of your heart rate, you can also control your nervous system. And the connection between the speed of your heart rate and your respiration is respiratory sinus arrhythmia, as indicated by heart rate variability, which gives you some feedback of vagal tone and the state of the autonomic nervous system. So even as you just sit there listening to me, I would really like that you're not being stuck on your head, that you're taking your attention out of your head and into your body and onto the breath. And that you're just gently telling your brain that you are safe. You're taking that soft breath of air in through your nose, and you're just having that slow and relaxed and a gentle breath out. And don't worry about how well, or it doesn't matter how you're doing it. It's just about gently softening the speed of the exhalation. And even if you just walked away with that exercise, I will genuinely say that it is so simple. I have used it many times, and I even used it today because I sat there for about 10 minutes before I got on today. If I want to get on stage, or if you're going into a challenging situation, you don't want your nervous system letting you down. And you bring this into your practice, and also as you're listening to your patients, and I'm sure you do it anyway, you're bringing attention into the body, you're bringing your attention onto the breath, and you're listening to that person with every cell of your body. You're not just listening to that person with your head. Now what I would like you to do is I would like you to soften your breathing a little bit more to the point that you have air hunger. And I would also say that if you are having your mouth open, do your best just to gently bring your lips together. And if you feel a little bit of air hunger, it's okay. It's only carbon dioxide. So bear in mind that air hunger is not a deprivation of oxygen. Air hunger is signifying that there's a slight increase of CO2. But CO2 is improving your blood flow. CO2 is increasing oxygen delivery. Do you know when oxygen goes from the lungs into the blood, it's carried by hemoglobin? And one factor that causes oxygen to be released from the hemoglobin, from the red blood cells to the tissues and organs, is carbon dioxide. As carbon dioxide increases, blood pH slightly drops, and hemoglobin releases oxygen more readily. And that's why I was saying, if your goal is to optimize your breathing patterns, we have to think downstream. We can't be just thinking upstream, yeah? So you're going to feel as if you're going for a walk. Is that okay? I'm going to start off for a very short period of time, and then we will increase it. And I would like you to see, how does your body respond to the slight air hunger that we're going to put you through. You know that if you get stressed, your heart rate gets a little bit faster, your mouth might go dry, you feel tense, yeah? But you also know that if you go into relaxation, your heart rate slows down, you'll have increased watery saliva in the mouth, and you feel sleepy. If you activate the rest response, you feel sleepy, and if you activate the digest response, your body is ready for the digestion of food, and it will produce watery saliva. So your body will tell you a little if you're stressed or not, yeah? So I'd like you to have one hand on your chest and one hand just above your navel. And don't worry about whether you're breathing high or low. It's not about breathing high or low. All I would like you to do is soften your breathing. And I would like you to soften your breath to the point that you feel that you are not getting enough air. And we'll do it only for about a minute starting off. So how do you do it? As you breathe in, can you slow down the speed of the air as it's coming into your nose? Can you really soften and slow down the speed of the air, almost that you feel hardly any air coming into your nose? And then as you breathe out, can you bring a total feeling of relaxation to the body, and you have a relaxed and a slow and a gentle breath out? And the objective here is, can you soften and slow down the speed of your breathing, but also take less air into your body, but not to the point that you feel stressed? So don't worry if there's a point at which it goes a little bit too far. Take a rest and then start again. So you're just taking one hand on your chest, one hand just above your navel. And all you're doing is just gently softening your breathing. You don't want to soften it too much. It's not too little, not too much. But any time that you feel stressed, you take a rest. So please listen to your body and don't listen to me. You're taking a soft breath in. You're really slowing down the speed of the air coming into your nose, and you're allowing a relaxed and a slow and a gentle breath out. There's a lot of you here in this room, so don't be too greedy with your breathing and leave air for other people in the room. Breathe a little bit less air. Breathe about 30% less air into your lungs. And as you breathe less air, it's okay, take a rest, take a rest. As you breathe less air, carbon dioxide accumulates in your lungs. And as carbon dioxide accumulates in your lungs, it will accumulate in your blood leaving your lungs. Take a rest there. Just take a rest now. Can I just see how many of you felt air hunger when you did that exercise? It's a few. Okay, we're going to take a little bit of a rest and then we're going to do it again. So the key is, it's not too little of air hunger that you don't feel much, but at the same time, it's not too much either. So if you feel tense or if you have involuntary contractions of the diaphragm, the air hunger has gone a bit too far. Does that make sense? And don't worry about how you're doing, because all you're doing is just gently softening how you're breathing. You would never breathe this way when you're stressed. Never. But why are we doing this exercise? Carbon dioxide helps to stimulate the vagus nerve. We're also exposing you to a controlled dose of air hunger to help desensitize your body's reaction to suffocation. We're also helping to increase blood flow and oxygen delivery. We're helping to slightly drop blood pH to reduce neuronal excitability. Look at the implications of CO2 in the default mode network, and both the activity and connectivity of the default mode network. But we're also helping to improve your everyday breathing patterns, so the drive to breathe is less. And I would also say for females, keep an eye on your breathing during the monthly cycle. So menstruation, follicular phase, proliferation, ovulation, luteal phase. So mid-luteal phase, there's an increase in progesterone, and progesterone is a respiratory stimulant. And if you're overly sensitive to the increase in progesterone, your breathing will go fast and hard. And if your breathing goes fast and hard, you can have increased pain perception, fatigue, anxiety, panic, and trouble sleeping. The symptoms of PMS are very close to the symptoms of hyperventilation. It is only one paper dating back to 2006, and unfortunately breathing in women, even though it is different to men, it just does not get research. Even though it has been known that women breathe differently going back 100 years. Women sleep differently, women breathe differently. Can we give that a go again? And don't worry about how you're doing. Just gently soften and slow down the speed of your breathing. So you have one hand on your chest, one hand just above your navel. And I would like you to soften and slow down your breathing to the point that you feel that you're going for a walk. So whenever you go for a walk, you have a slight sensation of breathlessness. Can you soften and slow down your breath? How do you do that? You could take a shorter breath in. So instead of taking your normal breath, take in about 30% less air into your body. Or you could really slow down the speed of the air coming into your nose. And then as you breathe out, can you bring a total feeling of relaxation to the body and have a relaxed and slow and a gentle breath out? Excuse me. I would like you to underbreathe. I would like you to underbreathe to the point that you feel a comfortable or tolerable air hunger. And bearing in mind that even though you feel air hunger, it doesn't mean reduced oxygen delivery throughout the body. Right now, we would expect that CO2 in the lungs and blood increases by about 2 to 3 millimeters of mercury. And every 1 millimeter of mercury increased CO2 improves blood flow to the brain by 2%. If you have air hunger right now, and if that air hunger is tolerable, you have an increase of blood flow to the brain by between 5 and 10%. You cannot dismiss that. Just by gently under-breathing, softening the breath. So even though you feel air hunger, just bear in mind, yes, it signifies that carbon dioxide has increased just a little in the lungs and blood, but think about what it's doing to you. Now it will also show in your eyes as well. Your eyes tend to go a little bit glassy. But what I'm interested in is, I'm interested in how your body is responding to air hunger. Does it tip you into a slight fight or flight response, or does it activate relaxation? So can we do it for about 1 minute more? Just gently softening your breath, but again, listen to your body, and if you feel stressed, please take a rest. So if you notice that you're feeling a bit tense with it, just take a rest and go back to your normal breathing, and it's okay to take a rest, and it's normal that you will need to take a rest. So if you have involuntary contractions of the diaphragm, or you're feeling a bit off, your heart rate is elevated, please do take a rest. But otherwise, do your best to gently soften and slow down the speed of your breathing. And the other aspect of it here is you might notice that your mind is more anchored onto the breath. You might notice that there's less of a tendency for the mind to wander when you have reduced breathing and air hunger, because think of the effect of CO2 on the brain. The brain, by regulating breathing, regulates its own excitability. How does it do that? It's through the mechanism of CO2. You will have quieter mind. With reduced brain cell excitability, it can be easier to hold attention onto the breath. Take a rest there. I'm just interested, because there's quite a good group of people here, who feels that it activated their stress response, that they felt that their heart rate has increased. Okay, can you look around the room? This is kind of synonymous. So it's about 5 to 10%. It's entirely okay. Okay, for you, go very, very gentle. And what I would say to you is you could practice the small breath holds, or you could even practice humming, or just switch to nasal breathing during physical exercise. Physical exercise is a tremendous training for your breathing, and it's a tremendous training for your brain, but only if you keep your mouth closed. But 96% of people don't keep their mouth closed during physical exercise. They have their mouths open. And the other thing about physical exercise, it's a natural way to expose yourself to air hunger, and the body is more conducive to air hunger during physical exercise than during rest. So it's a nice inroad. Does that make sense? Can I just see a show of hands? Who feels that they felt sleepy as a result of doing that exercise? And look around. Look around. Okay? And who feels, or did anybody notice any increase in the saliva in the mouth? Can I see a show of hands? Look around. So this goes beyond mindfulness. Mindfulness is a tremendous tool, but it's a tremendous tool after you get your breathing right. It's a tremendous tool when you have some capacity to help reduce the rumination of the mind. And every time that you have your attention on your breathing, you are being mindful. And it's not just about doing this practice, say in the lotus position, or having to wear a particular rig out or anything like that. Listen, we have two choices in life. We can either go through life, we're stuck in our head ruminating, or we're not. And I will genuinely say that we can train the brain. And I will tell you that because I've had about 8,000 to 10,000 clients over the last 23 years, and I have seen it we can help significantly by changing breathing practices. But I will say, it's not about slow breathing. And if you are practicing slow breathing, that's okay. But take into consideration that when you slow down the respiratory rate, what is happening to tidal volume? Because you may inadvertently be increasing minute volume. And if you're causing your client to breathe more air, they're feeling lightheaded. They can be feeling the symptoms associated with hyperventilation. So this is where the subtleties of breathing come in. Now, what I would like you to do is to get your phones, if you have a timer on your phone, and I would like you to measure the length of time that you can comfortably hold your breath for. And I'm not sure how much time I have left. Am I over? Yes? Oh, sorry, nobody told me. So listen, if I'm over, okay. Please, I hope that I planted a seed on the potential of breathing. I think it's going to be a tremendous modality in mental health. It's a very targeted approach to directly impact the brain, the nervous system, and sleep. It's tools that don't cost anything. It's tools that your clients have for the rest of your life. It's tools that you can use. So our website, if you are looking for information, is buteykoclinic.com. And we have launched the first training course for mental health instructors, specifically psychophysiological breath training in the world. But it's based on 23 years of experience. Thank you very much.